is there like a anti-reflex diet or that sort of?
Not specific. I think it's these first line measures of the pureeing, and then with the use of your blender, you can make your consistency different from that end of what a child will tolerate, and that would be the benefit and the support from the occupational therapists. The Swallow study, when they do a video Swallow study, the OT, or even looking clinically, they will offer different consistencies of fluid to a child and see where that tolerance is at, and then can give advice with regard to how you would modify a diet for that.
One more, Dr. Harrison. Sorry, I probably don't mean the N1 type study. Is there a best practice for us to discuss that with our neurologist? And if there isn't, can we make one so that we can at least say, look, here, we believe this may work, and this is the way we can study it? And
I think it's something you have to do on an individual basis, but I think it's something we could work with the foundation on how to manage that. Because, as I say, the ideal, of course, is to do these large clinical trials, but in reality, we're not going to be able to do that. We all know that is impractical. So I think we ought to try to do it in as controlled a fashion, because really that's what we're doing in clinical practice every day, but people don't think about it in that way. As I say, in child neurology, it's the management of epilepsy where this happens, and it's the biggest problem. And it's also an issue, of course, in epilepsy, persons with epilepsy and adults who have seizures, pure adults. So yeah, I think it would be a good thing we could maybe talk about more with the PSA and give some guidelines to help. I think it's part of good practice, but it's something that's just important.
They don't want to label and.
Michelle has something that we noticed about 2 weeks ago, and we think it's from the use of silcoplane patches, but underneath her tongue on one of the glands, it's actually swollen. And we took off the patches for about 10 days. We hadn't seen a difference on it. I don't know if she's patches at all. We gave her one patch, 2 each before we left. So it's just, we're not sure how it's making her feel, because she's not talking, or she's on the feeding tube, so she doesn't have to eat or swallow. But it's just a symptom we had not seen before, and I don't know if anybody else has noticed that.
Drooling is a really big problem with this condition. And in fact, I've even met families where infected family member underwent tracheostomy because of the continual aspiration of saliva. And I've had, this has been one of the biggest challenges is to try to deal with. I've had limited, but some experience with scopolamine patches, and I was not really impressed that they did have a major effect. The swelling of the submandibular gland could be the result of could be a side effect of the scopolamine, which tends to decrease the secretion and therefore the swelling of the gland. The gland, by the way, salivary glands are particularly susceptible to inflammation in people who are not eating. If you eat, it stimulates the salivary glands, which is good. It's like physical therapy for the salivary glands. If you don't eat, then the salivary glands become dormant, and that becomes a setup for inflammation, not an infection, but an inflammation. That may be it.
Okay, so it's kind of what we've been told, but we haven't been able to reduce it. Nothing's worked to reduce it. We stopped putting patches for a week, and
Is it gland in the neck?
well,
Under the tongue.
Sorry, just for this one. It actually looks almost like a second tongue. It's pretty substantial, and it's coming off the side of her mouth, so it's along the jawline, just on inside.
It could be a lymph node, or it could be the submandibular gland, or it could be part of the parotid. All of these are salivary glands except the lymph node. You really can't say without doing physical examination. But your doctor should be able to tell you whether it's salivary gland or
going to just say, well, with regards to patches, some families we've had an experience of actually that it's the same as the ones you use for travel sickness, that you can cut them up and divide them up and work out a regimen of how many days on and how many days off that may you get the right balance for your symptoms from a secretion perspective. So there are ways to play the system.
This might be a good point to segue into local products.
Well, thank you very much. There's just a couple of things I'd like to underscore before pursuing a talk on diet. One is like the kind of elementary therapeutics. One I'd like to really underscore again what Mark has said a few times, and I've said several times in other audiences. It is a real mistake to say that there is no treatment for this disease. That's a way of saying, that's like saying I'm abandoning you. There's lots of treatment. We're talking about treatment that makes a difference. I had a very cynical colleague when I was a fellow at the Montreal Neurological Institute who described life as a fatal disease. Well, in fact, we do all kinds of things to make our life better without necessarily prolonging it, and we consider that to be important. The other thing is that treatment always involves a trade-off. Any kind of intervention involves a gamble. And the gamble is you're trading one set of problems for another. And sometimes the trade-off is obvious. For example, the treatment of seizures with anticonvulsant drugs, the side effects of the drugs are often trivial compared with the seizures. But at a certain stage, if you over-treat, for example, and develop major side effects from the drugs, then you've got another set of problems that in some respects may be even worse than the original problem, particularly if the seizures are infrequent. Anyway, I also want to comment on the delay in diagnosis. It's a unfortunate reflection of the state of the art that the American Academy of Neurology publishes a series of continuing medical education journals, very, very high quality, called Continuum. And one of the most recent issues of Continuum was on movement disorders, and in that is a chapter on hereditary ataxias. And Niemann-Pick disease type C is not mentioned. What is mentioned is juvenile lipidosis, which is an old term for Niemann-Pick disease type C without any elaboration. So this represents a major challenge. In the neurology community, it is important that people be made aware of this condition as a cause of movement disorders and other problems. Okay, I've expanded the mandate a little bit. I was asked to talk about diet. I'm going to talk about diet and nutrition and some other elements of feeding. I'm going to divide what I have to say into three parts. First, talk a little bit about the physical, mechanical components of feeding. A second on nutritional or therapeutic aspects of feeding. And finally, the emotional component of feeding. On the physical